Bismillahirrahmanirrahim. Assalamualaikum everyone. So today we are going to conduct a mock interview, and so for the interviewer panel we have myself, Muhammad Hazri, we have Julia Kaisara, and we have Camelia Afrina. So for our candidate we have Muhammad Haziq. So without further ado, let's just dive into our interview today. So firstly, can you tell us about yourself, Muhammad Haziq?
Sure. So, hi, my name is Muhammad Azir Hakim, and I'm a recent graduate with a bachelor degree in medical imaging from IUM Kuantan. So, throughout my 4 years program, I consistently performed well academically, and I can say this by showing my result. I had achieved a CGPA of 3.78 and being on the dean list every semester. So during my studies, I completed internship at 4 different healthcare facilities, including SASMEC or IUM Hospital, Hospital Ampang in KL. And this internship exposed me to a range of medical procedures like X-ray, CTs, MRIs, and ultrasounds. I also had the opportunity to interact with patients directly, one-to-one, honing my communication skills and learning how to deliver compassionate care. I am passionate about using diagnostic imaging to improve patient outcomes and eager to begin my full-time journey as a radiographer in a professional healthcare settings.
Okay. So what do you think motivate you to pursue a career in medical imaging?
So growing up, I like two things, healthcare and computers. So medical imaging perfected these both aspect. What truly inspired me was seeing how important it is for medical imaging or diagnostic imaging, as in the early detection or treatment of the disease. During a family member's illness, I witnessed firsthand how an early diagnosis through imaging helped to do a better prognosis. That experience stayed with me and reinforced my decision to enter this field. And I also wanted to contribute meaningfully by helping doctors diagnose condition accurately and efficiently, thereby playing a direct role in patient care. As I would like to think, and medical imaging is the first line defense of the healthcare.
Okay, very good. So now can you walk us through your internship experience at SASMEC or IIUM Hospital?
Yeah, sure. So in my internship days at SASMED, I was part of a well-organized radiology department for 3 months. And during these 3 months, I had chance to assist most of the radiographers there in various procedures, including X-ray, which is very common, and CT scan also. MRI and also ultrasound. What I did there is range from preparing patient, explaining procedure, and ensuring proper positioning to help the senior radiographers during my days. I also learned on how to handle emergency cases with composure, especially during when I was uh, s- sit at the emergency department. And I also learned many things from them. I was particularly commended for my ability to make patients feel comfortable and my dedication for maintaining high standard for patient care. And my time there taught me the importance of teamwork, time management, and also patient-centered service.
Okay. So how do you handle nervous or uncooperative patients during your internship days?
So I believe that empathy and clear communication are the keys. Many patients feels anxious during imaging procedure, which is typically normal, and they feel this especially if they are in very pain or unfamiliar with the process. So what I do is I first introduce myself, explain what to do, explain what to expect, and reassure them that the procedure will be safe and also quick. I use calm body language and respectful tone to build trust for them. For uncooperative patient, especially for like children and elderly individuals, I adapt my communication style to suit their needs, and sometimes use visual cues or physical demonstration to guide them through the process. And especially, I will not use any medical jargon with them. And my goal there is always to make the patient feel heard, respected, and cared for.
Okay, so lastly for me, um, what imaging equipments are you most familiar with during your based on your experience of using them?
So during my clinical posting experience, I worked primarily with Siemens X-rays machine and also assisting in operating CTM MRI scanner. So I've gained confidence in understanding the imaging settings, radiation safety settings, and also the patient positioning. So at Sasmet and Hospital Ampang, I was also involved in the daily quality check for basic troubleshooting for the imaging equipment. And I'm eager to expand my technical knowledge further and receive in-depth training on more advanced systems like digital fluoroscopy or IR, interventional radiology units.
Okay, next question is how do you ensure radiation safety for yourself and patients?
So I strictly follow the ALARA principle, which is as low as reasonably achievable. Before any procedure, I check the exposure setting to ensure proper collimation and shielding. So for fashion, I use equipment like lead aprons and tie rod shield when appropriate, and minimizing repeat exposure by ensuring accurate positioning for the first time. So I take my time when first I attend the patient. Personally, I wear dosimeter badge and follow all the department protocols, including standing behind protective barrier when required. So during my internship, I made a habit to double check all the safety procedures before initiating any scans or any procedure, which was appreciated by my supervisors.
Okay, next is what would you do if an image did not come out clearly?
So first, I will assess what went wrong first, whether it was the patient or whether it was the positioning or the technical settings. Then I calmly explain to the patient why the repeat is necessary. So ensuring their comfort and cooperation. I will correct the issue, whether it is adjusting the technique or repositioning the patient, and explain to the patient further what they need to do. And if the patient continues to lack the quality that I needed, I will inform to the senior radiographers or even the radiologist for guidance. And my goal is always to avoid unnecessary repeats while ensuring the best possible image quality for accurate diagnosis.
And how do you handle stress or a high workload during peak hours?
I handle pressure by staying organized and prioritizing tasks. I remain calm and composed, which help in managing both technical side of the imaging and the interpersonal demands of the patient care. During my internship at the HTAA, Hospital Tengku Ampang Azan, I often work during high patient influx hours, and I learn to manage time efficiently, prepare patient in advance, and support my colleague when they are needed. So during my time, I take that good communication with team and focus on the patient care, keep things running smoothly even under pressure.
Okay, my last question is what are your strengths as a radiographer?
I like to think that I am technically skilled, fast learner, and deeply compassionate towards patient. I'm also known for my attention to details, which vital in the image quality and radiation safety. Additionally, I am self-motivated. I don't wait to be told what to do. I anticipate tasks and step in where I am needed, and my clinical supervisor appreciate my abilities to work with minimal supervision and maintain professionalism in high pressure environment.
Okay, next is what a weakness you are working on.
One area that I'm continuously improving is my public speaking confidence, especially in formal academy or departmental setting where I am very comfortable speaking with patient or small groups. I initially found larger presentation very nerve-wracking. However, leading event as a head of entrepreneurship during my studies days helped me grow in this area. So I learned to organize my thought clearly and speak with more confidence in front of the audience.
Can you describe your involvement in extracurricular activities?
So I was actively involved in during my study days as a leadership of head of entrepreneurship for my imaging for my student association. So one of my case the initiative was introducing a vending machine at our kuliah to create a sustainable income stream for the student activities. And other than that, I also led a food festival, handling logistic, budgeting, and vendor coordination. And this experience improved my leadership, project management, and communication skills that I believe are very valuable even in clinical settings.
Okay, next, how do you stay updated with current practices in radiography?
So I make it a point to read medical imaging journals or studies and follow Radiology Association online. There are groups on social media. I also engage with forums or webinar or what we call it as a CME to stay informed with the technological advancement in case study. IUM provide a strong academical foundation that I intend to build on that through continuously professional development and eventually certification courses of postgraduate studies in the diagnostic imaging.
Okay, next is what do you know about our hospital clinic and why do you want to work here?
So I know that your institution has a reputation for excellence in diagnostic imaging and patient-centered care. I've read about your adoption of advanced imaging technologies and interdisciplinary teamwork, which really appeals to me. And as someone who value continuous learning, I see this hospital as a place where I can grow, contribute to high quality patient care, and collaborate with experienced professionals in a very supportive environment.
Okay, the last one is do you have any question for us?
Sure, I love to know more about your training program for new hires. How does your team support fresh graduate in adapting to the clinical environment? And also, are there opportunities for specialized or cross training in other modalities such as MRI or interventional radiology?
Okay, tak ada jawapan. Sekejap eh. Okay. Boleh sambung. Sambung terus lah jawapan. Di mana-mana. Okay, so good question. So we support fresh graduates through structure orientation. So and we also provide hands-on training and mentorship by senior radiographers. So after gaining experience in general radiography, you will have opportunities to cross-train in areas like CT, MRI, and other advanced modalities. And we also encourage continuing education in professional development. Do you have any further question for us?
I think that's all from me.
Okay, thank you so much, Mama Haziq, for attending our interview. We will be in contact we will be in contact with you within this week, and we will let you know if you get the role. Thank you so much.